All right, I believe we are live. Good afternoon. This is Bariatric Friday. My name is Kemal Erkan. I'm the chairman of American Surgery Center and United Medical ACO. I'm here with Dr. Isaias Irgau. Dr. Irgau, how are you doing?
I'm doing great, Kemal. As usual, very happy to be back on Bariatric Friday.
Well, it's always good to have you. Today we are going to actually discuss the social stigma around morbid obesity. As we do these types of events, one of the issues that we have while we are trying to do our job, we also try to actually educate public, as morbid obesity is it was not a recognized chronic illness until 2010 with Medicare, based on Medicare guidelines. So from 2010 to now, it's about 12 years. So relatively new defined disease. Therefore, there are a lot of public opinion and there are a lot of stigma. And then from the when we see these, we don't have a choice but bring these up. Sometimes we do this from the specific topics, and then sometimes we just discuss the actual stigma. And today is one of those topics one of those discussions that we are going to have. So, Dr. Irgau, I know I kind of started with this, but didn't let you introduce yourself. But how are you doing? How was your day today?
Great. Just finished 2 bariatric cases at St. Francis today. Everything went well. Everybody is doing great. As you know, doing bariatric procedures, particularly gastric bypass, sleeve gastrectomy, I find really most satisfying procedures. So I had a really good, productive day. Thank you.
All right. So just want to give a little bit background. So this is, other than 2 of us, we do have our team, so many people who work with us. Some of them are clinicians and some of them are our administrative office. So then I got this video after our last session, I believe. It was 2 weeks ago, perhaps. And then it was a 10-minute video, and then I was on my way home, and I started watching it, listening it, rather, maybe, so then you don't panic. So, well, immediately I sent that to Dr. Erkan, and then we said, well, you know, this is one of the main issues that we are having with people's understanding, and how little this understanding is happening, and this really important topic is being discussed without a specialist. Someone who's the expert on the topic is not being in that setting. And then I'm like, okay, so these guys are talking about this really important issue. No one is mentioning the most effective way of dealing with the morbid obesity, which is bariatric surgery. And then we maybe better understand what may be really happening behind the closed doors, and this wasn't a closed door, so this was right in front of the I believe this is from BBC. So I'm going to actually share one small clip from this video, and I will build the discussion around that. Let's try and then see if everything. I'm going to need my team to send me a verification of the sound of the video. So, but let's go ahead and share what we have. So this is our first one. This is the introduction of this. And let me actually play the second video as well.
Sure.
But it's whether we should be celebrating a body image which is medically defined as highly dangerous. And I'll explain why. If you don't mind me just going through some stats here. You're 36 years old, you're 5'4", you're 380 pounds, 27.1 stone, and your BMI is 64.6. Now, the BMI ranges, according to the World Health Organization, 18 is underweight, up to 24 normal weight, 25 to 29 overweight, 30 to 34 class 1 obesity, 35 to 39 class 2 obesity, anything over 40 class 3 obesity, which is morbid obesity, i.e. a level of obesity which could very possibly lead to early death. Your BMI is 64.6.
So do you think that Angelina doesn't know all of this?
No, the reason I'm saying it is so that viewers can understand the debate properly. My argument is this, is that when you are that level of morbid obesity statistically, is it right to put people like yourself into a pop video celebrating that kind of weight? And I ask you honestly, to be honest with yourself. We've had all this with Tess Holiday. She's on the cover of Cosmo and it's all celebrated. There's a mention of it being a dangerous weight.
Honestly, if you were really
All right, Dr. Erkan. So, well, of course, watching this for someone like us, for me personally, is terrifying. Terrifying in a way that you and I, we do this show almost every Friday. And I wouldn't do this show without a clinician with me, without an expert. And I would consider myself an expert on the non-clinical side and knowing the topic very well. But I would still, if I was invited to that show, I would definitely ask you to come with me or go there instead of me, because you would be giving better information. And it would be from the expert. But what was your take on this when you heard this introduction of the issue?
So, as you said, Kemal, this is a primetime show, through the BBC in the United Kingdom, and there are many problems with this presentation, but there is a hugely missed opportunity as well, as you said, right? So there are problems really starting with the fact that there is clear, blaming and victimization of a person who happened to be morbidly obese, right? Of course, in their view, they are trying to, highlight the fact that this person who suffers from a serious level of morbid obesity has gone to a show, celebrating her body, right? When we talk about how obesity is presented in our society, it's far more common, to see shows where people with morbid obesity are stigmatized and treated unfairly and teased, as opposed to celebration, really. So that's not a major issue from that point of view, right? And then it's a missed opportunity because, as you correctly say, they are talking in a public forum about a serious medical problem, serious public health issue, and they're not really addressing the most important fact, which is that there is treatment available, right? There is a lot of finger pointing there, right, towards the person who is suffering from morbid obesity, right? And that is an issue, and that's an issue that we see all the time. Finger pointing, blaming, stigmatizing people with morbid obesity actually worsens obesity. It doesn't help them, right? People say sometimes, oh, if I tell them openly that they are really this and that, maybe they will do something about it, as if it was something that you can fix with a snap of a finger, right? Come on. Mm-hmm. But actually, study shows that when you stigmatize and treat unfairly or tease people who are suffering from morbid obesity, you make their situation worse because you make them more depressed. And the more depressed they are, what do? They reach out to things that make them, happy for the moment, which may be even binge eating. So obesity actually worsens when you are really highlighting their problem in such a fashion, as opposed to bringing it up as a medical issue, right? We don't talk about high blood pressure or diabetes in these terms, and yet morbid obesity is that. It is a disease. So taking the blame out, taking the finger pointing out of it and just discussing it as a medical problem, right, would be much more refreshing and actually providing solutions, because as you correctly said, there is treatment for this. And it's interesting that in a show of this level, they are not bringing up bariatric surgery. They are treating bariatric surgery as if it was a closet treatment, as opposed to a very important component in the treatment of morbid obesity. Yes, so there are many issues. But of course, this, Kemal, as you know, stems from a larger problem that we have in the society where there is total stigmatization and discrimination against obesity. Studies have shown that this actually starts very early in life. Children as young as 3 years, Kemal, have been shown pictures of children who are obese and pictures of children who are of normal weight. And then when they were asked what their thoughts are about the children who are overweight, the first things they talk about is that they are ugly, that they are undesirable, that they are not good playmates. These are children 3 years old who think that way. And then, of course, this goes on as the children grow up in school, right? In school, teachers, peers, the other kids, right? There is a lot of bullying. There is a lot of psychological and physical aggression on children who are overweight. And this goes on in the school. It goes on even in the family, within the family, siblings, or even parents are very cruel towards their children who happen to struggle with obesity. There is a study actually come out that has shown that the quality of life of children who suffer from obesity is similar to that of children who suffer from cancer. Just think about that, right? Mm-hmm. Because of the way they are treated, right? And of course, if this problem is not rightly addressed, children who are overweight are likely to become overweight in life as well. And what expects them when they enter the adult life is that the same discrimination again. If you look at the workforce, for instance, people who suffer from obesity, Kemal, are less likely to be hired when they apply for jobs, are less likely to be promoted within the same job, and they are more likely to be fired more readily, compared to normal weight peers. So this unfair treatment, this teasing, this even discrimination goes on and on. And does it help? It doesn't. It makes it a lot worse, right? And then from a social point of view, it's just so cruel as well, Kemal. So for this show to really bring about such an important issue, and yet not to talk about the treatments available and not to be supportive to that towards that person who's struggling, is shameful in a way, right, Kemal? And I'm not sure whether you have more clips to bring, but
I do.
Nobody is happy to be, at a BMI of 64, because clearly their quality of life from the moment they get up from bed until they go to bed at night, they are suffering because it is physically painful to carry that much weight and carry on your daily chores.
So we have 4 other clips, Dr. Ergau, and I'm going to build the discussion a little bit. So let me ask you, someone who's morbidly obese, they may not be looking any help, and they may be okay with what's happening. It is what it is. But I think the reason this comes up, and then the reason they brought up this person, is the celebration of morbid obesity. I know you don't want me to use the F word, but this is the 3-letter F word, not the 4-letter. So, but they do use it in the show. So there's this celebration part of it, because I was actually, I was kind of, struggling with the entire video, because if this person had a heart attack, or if this person's A1C, hemoglobin A1C, was 15, and that means they are severely, they have severe diabetes. If they have COPD, if they have kidney failure, the approach, and that's what you were kind of leaning on, like approach would be different, right? So then we are not comparing, well, I'm not looking for help anymore, so I'm happy with, like, this discussion wouldn't happen if someone had a kidney failure problem. And the same thing with the heart attack. So this discussion is happening because there's still the lack of understanding of this disease itself. So now let me bring the third video where she now is on attack. So
people being obese.
Hold on, I'm going to share the screen. All right. So
Kemal, clearly, I actually disagree with the presenter in the show that this lady is celebrating obesity. If she was celebrating obesity, she would not be telling him, you are also overweight, right, to him, suggesting that it is something that is a problem for her as well. In fact, later in the show, I don't know if you're going to show it, she does go on to say, look, I've done everything I could. I've tried all the diets. Nothing has worked. Somebody who wants to celebrate this situation doesn't go on trying diets, right? And also you would say you're celebrating this situation to somebody who actually sets out, they were thin, and then they set out to become purposely overweight, right? And then they go on to show. But somebody who's actually struggling with this, and they've tried everything they could, but obviously nobody has, presented them bariatric surgery, but she's tried everything of the traditional ways of dealing with obesity, and she has failed. And now she's saying, you know what? Okay, let me just do something about it. And I might as well live with it and do this thing. So that's her viewpoint. She's not actually saying that she is happy and has a good quality of life. That has not come out from her mouth, right? In fact, she is pointing her finger at him and saying, oh, you yourself actually may have an issue as well, right? So I don't think she is celebrating. What it is showing us is that she really has not seen a way out from this. And that is a problem that we see time and time again. You and I, we always talk about the fact that bariatric surgery is the most effective treatment we have, and yet only 1% of the people who are eligible for the surgery are come forward. One of the reasons is that there is this classification of bariatric surgery as something that should not be done, that people should somehow do it by themselves. It's a cop-out. It's a easy way out, right? Kemal, that's the way it is presented. And it's obviously clear that even those presenters who are saying that this is a serious medical problem, and yet they don't present somebody with clinical knowledge and also with solutions, right? There is no discussion about bariatric surgery in this show at all, which is really a hugely missed opportunity, of course.
So I think one of the issues that I see with her approach is she kind of goes down to the look of the person rather than the health issues. So yes, the look is the part that maybe we enjoy if we are in good shape. But this is not about the look, right? So she's kind of maybe coming down to the look only, and then like saying that I'm happy with the way that I look. And then later on, she talks about I think she's in her low 40s, and then she doesn't have a problem dying young. So I know from the Piers Morgan side, this issue, the way that he's approaching, it's almost like attacking this person is one thing, and I have a problem with that. But also, she's making herself an easy target too. Now, I think the biggest problem is for someone like her to become the voice of the people who's struggling with morbid obesity is the problem that we are having.
Absolutely. I do actually sympathize with her, Kemal, to a great extent. And that is really out of the fact that I have been working with people with morbid obesity. What's that?
This is why you are the clinician in the relationship.
Oh, so. Absolutely. I do sympathize because I think it is extremely difficult to lose weight, right? So, you say she's making herself an easy target. Well, she has been an easy target all her life because of her weight, right? It is very likely, although I don't know her story very well, it is very likely that she has struggled with weight all her life, right? She's in her mid-30s right now, BMI of 60-something, which means that this is not a problem that has come up in the last 2 years, right? Most likely she's had it since, childhood. Mm-hmm. And as I said before, children who suffer from obesity or who are overweight are always teased, right? Continuously, right? Whether it's in the classroom, whether it's in the dining room, whether it's when they are having a snack. And of course, this extends everywhere as well. There is social isolation as well. right? And that is the world where she is coming from, where she's saying to herself, look, if I can't get out of it, I might as well, live with it and show it off. That may be the view. Clearly, this is the wrong message, right? This is the wrong message because
this is where she accepts actually this next
absolutely accepts. But the problem here is that from her point of view, if she's looking at it just as something that is affecting, her looks, that is where our problem starts, obviously, Kemal, because as clinicians, we know that the higher the body mass index, the more chance there is for a person to develop serious medical problems, whether it's type 2 diabetes, high blood pressure, sleep apnea, or a myriad of other problems that affect almost all organ systems of the body, right? That is the problem. And then, of course, life expectancy is also shortened because of that. Right?
And that's actually coming up. Let's listen to this, Dr. Erkan, so then we'll continue.
Yep.
Now with Tess Holiday Now You of glamorizing morbid obesity, which actually is dangerous. And I'd say this for your health as much as anything else. It's like, it is a dangerous way to be. Do you accept that?
Well, Piers, honestly, I will tell you, I am not healthy. I'm not going to pretend like I am in perfect health, but I am 46 years old, not 36.
Okay.
I'm 8 years younger than you and don't look my age. But the health problems I have are more age related than weight related.
Okay, I mean, look, I feel the same way, by the way, about the size 0 models on catwalk.
So again, the problem is she's there by herself, and then these people are the hosts of the show, and then they brought her up there. So I think they're just they're guilty of doing this. So because this discussion, when you are having it with this person, it's not the best way to handle this, because when she says she's unhealthy, but that's because of her age, that's not true.
It's not, Kemal. I mean, to his credit, Piers Morgan also is pointing to the fact that morbid obesity is actually a dangerous condition, right? He's talking about the seriousness of it from a health point of view. And, her response from her point of view is also acknowledgement that there are health issues, right? Somebody in their mid-40s should not necessarily be having chronic medical problems, right? Unless obesity is part of the equation. So, clearly, as you said, if there are any chronic medical problems, they are much more likely to be related to the weight as opposed to her age at this stage, right? And yet, there is acknowledgement from her part. But that acknowledgement, Kemal, is almost as if she's given up on it, right? As if she's saying, you know what, it is what it is, right? Mm-hmm. And that's where we are failing also as clinicians, because we are not presenting the fact that there are important treatment options, even for people of this extreme level of obesity, that her life could be transformed literally with her losing, as much as, 200 pounds, even with bariatric surgery, and to become a much healthier person, right? So that is very, very possible. And that may be part of the issue as well that you and I are trying to address in this forum, is to really come out and say, look, there is treatment available, which is safe, which is done in exceptionally high quality standards because of the setup we have right now through the quality control centers that we have, like the MBSAQIP, for instance, which our bariatric center is part of, right? So it can be done in these settings. And yet that part of the discussion is, of course, missing, even in important, forum like the one that we are looking at.
So this is where she's accepting the issue. So there's a point where would we actually celebrate if someone has bulimia or anorexia, right? So we wouldn't. Because we know that this is really dangerous. But knowing that she's 64 BMI, 5'4", and 380 pounds. And actually, I'm similar to Piers
Yeah.
Morgan. So I'm 6'1" and about 217. So, and that's about 28 BMI. That's still a lot of BMI. So, but when the issue of, okay, how dangerous this is something that maybe people are missing, right? So the risk is people are like, no one wants their kids to be anorexic. And then if they are, then they don't want them to go on TV and then talk about how great they feel about this. That's part of the stigma is maybe, or the perception, misperception, whatever you want to call it. That's where the problem is, right? So,
absolutely. I mean, the show starts on by, showing relatively good intention in that it is saying we should not be glamorizing a serious health problem, right? Morbid obesity. And yet, if you really listen on how this conversation is being carried off, Kemal, there are some missing issues, right? For instance, they are comparing the glamorization of anorexia with the glamorization of morbid obesity. There are fundamentally important differences on these two paths. Somebody who becomes anorexic on purpose because they see that they have a mental health problem, right? Because they see themselves as heavy when they are actually very, very thin. And this is being pushed by an industry which is demanding that perfect body, right? So people actually go on purposely not eating or purging to become that, right? This lady in the show or others like her are not purposely trying to become obese. In fact, they've tried to get out of obesity very much and they couldn't, so they are living with it. So there are important differences there, right? And that what is missing here is the understanding that struggling with obesity is a difficult struggle. It is very, very, very hard to lose weight by yourself, right? You can do it at home, you can do it at work, you can do it anywhere, but when you try and you don't have real help, all you do is gain weight over and over again to find your weight even higher than when you started to, with a particular diet or program. It is a difficult problem. And that is what has led this young lady to do what she is doing right now. In other words, I tried. I couldn't. I am here. I might as well do XYZ with it. That's the way she's approaching this. It's not necessarily that she wanted to become morbidly obese and she worked hard to become obese. That is the main difference that we need to understand, is that nobody that at least I know is happy to be morbidly obese. They wanted to get out of it, but they haven't been able to find a solution for it. And that solution is being hidden, like in this show as well, right? It would have been much, much easier for them to call somebody like myself, and there are plenty of bariatric surgeons or weight management specialists in the United Kingdom to be part of the show for them to have that discussion. And then the whole issue of discrimination, stigmatization, blaming would be highlighted and maybe taken aside, and people would be talking about what the real problem is. Because clearly, when we look at shows, Kemal, there are many more shows that actually stigmatize and tease obesity than there are shows that glorify obesity. If you think about it, it is a far bigger problem in the social media or in different in the show business. A much bigger problem is actually discriminating and laughing about people who are struggling with their weight.
Sure, the issue of this, one of the concerns is like, is this celebration turns into be a role modeling? So let me just play this next video,
sure,
which is the final one on this, so that we can continue again. So again, I know his approach is a little bit harsh, but I think he has a point. So when the person who's out there and then trying to be famous with the problem that they have, they may be more useful if they are actually trying to fight that problem rather than just trying to make that problem like normal, right? So she's normalizing a little bit, like, okay, this is what it is. I'm going to do this. I'm going to make money. I'll die at age 47. Well, I don't want my kids watching this. If I had kids, I would want them to watch this. Right?
Well,
that's a problem.
It is a problem. Well, I actually don't think Piers Morgan has a point on this issue. He's missing the point, right? What he's telling her is, why don't you do a fitness show where you are trying to lose 100 pounds, right?
Mhm.
Does he know how hard it is to lose 100 pounds by trying to stay fit, right? When you're 100 pounds overweight, Kemal, trying to lose that just with diet and exercise, does he know, right? She knows. She knows, Kemal. What did she tell him? I tried. What is the point in publicizing something that doesn't work? She said,
She said
95% of the diets
diet
don't work.
doesn't work.
Doesn't work. Why does she know? Why does she know? He's probably more read than her, right? Just because of his position and knowledge. And yet she knows this. Why does she know? Because she has an intimate knowledge of it, personal knowledge, right? She has tried it and she has failed. And yet he is talking about it as if it was an easy thing that he could do. Why don't you do a fitness show and lose 100 pounds? Come on, we hear this all the time, right? Oh, you guys are doing surgery to make somebody lose weight. Why don't these people lose weight by themselves? Why don't they just eat less? Why don't they exercise? That is the foundation of that ignorance, Kemal, is not understanding that losing weight is by far one of the hardest things that anybody can do. And why is that, Kemal? Because as humans, we have been programmed to gain weight in the right circumstances. Mm-hmm. Gaining weight was a survival mechanism for us because for the vast majority of our existence, the biggest threat to our survival was lack of food. So getting food and preserving that food as energy in the form of weight was a survival modality for us. So our body treats gaining weight and losing weight in completely different parameters, right? Our body is designed to hold on to weight as much as possible, which is why even when we have a lot of extra energy in this form of fat, we're still hungry, right? We're still hungry. We still want to eat because our body doesn't worry about us having too much fat because it has evolved at a time in which hunger was much more prevalent than society. Kemal.
So, I have to do what I have to do. There is this picture that she posted that's actually coming a little bit from this. So, I have to give you a little anxiety too. So this is one of the pictures that she posted. Part of the, she's not so innocent, okay? Now, I know, I hear you very well, and then you know how we work with our patients together. But when this is normalization of unhealthy person. I'm not going to keep that on, and so then you're going to let me later.
No question, Kemal. There is no question.
When I put this out there and I say, look, I'm having, and I'm even getting paid for this. Whether they want it or not, they become like a role model. Would we actually want, like, if the people are selling their kidney, you know that that's happening there, right? So there's an organ mafia that they go after people, after kids. So if like someone says, well, you know what, I'm okay with one kidney, I'm going to sell mine, and then I'm going to advertise. That's where the problem starts. Now, knowing, not knowing or maybe knowing what issue they have, what access they have. Well, they have access to go to Piers Morgan. So you and I, we can probably reach out to him. So she is not so dumb in terms of access. So she should know about morbid obesity, right? But he should know about morbid obesity. If we are gonna, like earlier in our earlier session today, we discussed the climate change. Well, I probably easily put like 8 to 10 hour research prior to even introducing the issue. So if I was the TV anchor and then this person was coming up, then I would look for the most effective solution. Is what is the most effective solution for morbid obesity? And we know that the only one that works the most effective way is the bariatric surgery, and no one is actually mentioning this. And just going through this is about 12-minute video, and going through this whole video was a torture. So I'm like, well, we do this almost every week. We are out here and discuss morbid obesity and then talk about our patient's journey. And on the other hand, my optimistic side of it says, well, you know what, we are doing the right thing, because that means even at this level, people still don't get it, don't understand, don't know. So, and I believe because of that, I think these sessions are extremely useful, because if we get 300 people watching this and understanding what's happening, that's enough. Like,
absolutely, absolutely.
But,
yes.
It's on one hand, it's kind of extremely disappointing, but on the other hand, it gives me a better reason and more motivation to do more and do better, so that we can actually educate the public in a better way.
Yes, yes. I mean, what I have learned over the years, 20-some years in which I have been really dealing with obesity as a disease and contributing to the treatment of obesity, Kemal, is that I have yet to meet somebody who struggles with obesity and they're happy about their weight. I just have yet to meet them, right? So, which means that when you struggle with obesity day in and day out, carrying physically so much more weight makes your life minute by minute, hour by hour, more difficult, not easier, right? Physically. Even not being able to carry simple functions like tying your shoelaces, right? Or taking care of yourself. Those are serious handicaps that are directly related to the physical presence of so much weight on somebody's weight. So their life cannot be happy. On top of that, we talked about stigmatization in society, right? Everybody is going to look whenever somebody who is very, very heavy is walking around. Everybody is going to look at them if they are in a restaurant to see what they're going to be eating, just because of the concept and ideas we have, right? And we have this propensity to shame people, to tease people, to think negatively about them just because of their weight. And we've talked about the fact how pervasive this is in different areas of society.
And one of the things that you mentioned earlier, which if you remember a couple of months ago, I brought up this TV show, Family Guy.
Yes, yeah, absolutely.
And also, so these are really, really popular TV shows, and they are, again, going after these issues in a really wrong way. So then that was one of the concerns that I had. And I'm like, look, this is happening. Like, regardless of what we do, one of the most watched show is saying that, like, you don't let me use the F word, and then they use it left and right.
Absolutely, absolutely. But, nowhere does this hurt more, Kemal, than in young people, right, who are struggling with weight, particularly, in middle school, in high school, right? This isolation that comes on because they're struggling with weight, because really there is no safe place for them, not even at home very often, because even siblings or parents, particularly if they are the only ones who happen to be struggling with weight in that family, right? And yet, people assume that there is a simple solution and that these people are not getting out of it because they are either lazy or they don't have the willpower. That's the concept that society has, as opposed to think of obesity as a form of disease. So what was hugely disappointing in this show, Kemal, is the fact, as you clearly said, that it was all about blaming, finger pointing, as opposed to really taking all that out and talking about clear solutions.
Exactly. So this is, they don't have the expert in the group. They're approaching it really harsh because the person on the other side is vulnerable. So that's what they need to understand. It's a patient.
Yeah.
So, we wouldn't do that we wouldn't approach someone. If they knew that this was a disease, this was a chronic illness, they would probably approach it also differently.
Absolutely.
So, well, maybe, who knows, maybe they will hear, because we took some clips from them, so then maybe Piers Morgan will invite us to his show, and then we'll.
I would be very happy to be on the show, Kemal, with you and try to present.
We can beat him up a little bit.
Important points, absolutely.
Well, Dr. Irgau, today is 2 days before Christmas. I know we discussed really serious topics, but Christmas is on Sunday. Your Christmas is on January 7th.
That's right. That's right.
Others are this.
We celebrate both, though. We celebrate both the American and
I celebrate all of them.
Ryan one.
All holidays are fun.
Yeah.
So, I want to wish everyone a Merry Christmas, and we'll be back next Friday. And Dr. Irgau, thank you for joining me today, and we'll see you guys soon. Bye-bye.
Thank you, Kemal. Bye-bye, everybody.